Weakness on Ozempic or Mounjaro is not always simple hunger by itself. Sometimes you are eating too little, and that is the whole story. But just as often, the real problem is a mismatch between calories, protein, fluids, and tolerance. If you treat every weak spell like ordinary hunger, you can miss the pattern that actually needs fixing. Many people assume weakness means low blood sugar. That label is wrong. For people not using insulin or certain diabetes pills, true low blood sugar is not the usual cause. More often, the body is running on less fuel, less fluid, or less muscle support than the day requires. These drugs also slow how fast the stomach empties. Food may arrive later than expected, and meals may stay smaller than they seem on paper. That delay can make energy feel uneven across the day. That is why weakness needs a clearer explanation before you blame one simple cause. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. The first mechanism is simple underfueling. Appetite drops, meals shrink, and food choices narrow. Many people still eat enough to avoid obvious hunger, but not enough to support steady energy, activity, and recovery. That is why weakness can show up even when someone says, I am still eating. The second mechanism is protein loss. Protein helps preserve lean mass, meaning muscle and other non-fat tissue. When total intake falls for weeks, protein usually falls with it. The scale may look encouraging while strength fades. Low fluid intake can deepen that weakness. Some people drink less because they feel full faster. Others lose fluid through nausea, vomiting, or diarrhea. When blood volume drops, the body has a harder time keeping blood pressure steady, especially when you stand up. That can feel like weakness, heaviness, or sudden fatigue rather than thirst. The fourth mechanism is timing. A reasonable amount of food may come too late for the moment when your body needs it. Someone may skip breakfast, eat lightly at lunch, stay active all afternoon, and then feel wiped out by evening. The day may not look extreme, but the body still sees an energy gap. Two groups can look similar here, but they need different fixes. One group is truly eating too little overall. The other group eats an acceptable amount, but the pattern is wrong, protein is too low, or fluids are not keeping up. Those two groups can sound identical when they describe symptoms. They do not improve with the same first step. The next question is whether the weakness is mild or dangerous. Weakness from these drugs is common enough. True low blood sugar is a narrower problem. It becomes more likely with insulin or with sulfonylureas, a diabetes pill class that can drive blood sugar down. Without those, weakness usually means something else. Mild symptoms can hide a worsening problem, especially when weight loss makes the plan seem successful. Many people read ongoing weight loss as proof that everything is fine. It is not, because the body can keep losing weight while function gets worse. The body can lose fat, lose muscle, and fall behind on hydration at the same time. A quick sugary fix often misleads people. If the real problem is true low blood sugar, sugar can help in the moment. But a sweet drink does not solve underfueling, low protein, dehydration, or poor timing. Short relief may come first, and then the same weakness can return. Warning signs are less about one bad afternoon and more about pattern and severity. Mild weakness after a recent dose increase can happen. Repeated dizziness when standing, dark urine, a racing heart, near fainting, or trouble keeping fluids down should not be ignored. Those signs suggest the body is no longer compensating well. Another warning sign is weakness that does not improve after you deliberately eat, drink, and rest for a short period. Take in calories, fluids, and some salt. If the weakness keeps deepening, the cause may involve more than the medication alone. Infection, anemia, low blood pressure, medication interactions, or another illness may be part of the picture. Pay attention to the drug combinations around it. Blood pressure medicines, water pills, and diabetes medicines can amplify the problem. Some people blame only Ozempic or Mounjaro. In reality, several medicines together can make the body less able to handle low food or fluid intake. The same is true after a new dose increase, because a higher dose can make an existing food or fluid mismatch more obvious. Random snacks usually fail because the first step is finding the main cause. The problem may be too few calories or too little protein. It may also be too little fluid and salt. Another cause is a medication combination that makes your body less able to handle eating and drinking less. That decision tells you whether to start with food, fluids, or a medication review. If the main problem is low total intake, the fix is usually smaller and more frequent eating, not one forced large meal. Many people do better with an early protein-based meal and one planned backup snack. That gives the body fuel before nausea and fullness build later in the day. Waiting until you feel weak is usually too late. If the main problem is fluids, guesswork is not enough. Deliberate sipping through the day often works better than trying to catch up at night. Some people also need more salt, especially after vomiting, diarrhea, or very light eating. That does not mean everyone needs a sports drink. It means plain water alone may not fully solve the problem. If the main problem is declining muscle support, protein alone is not the whole answer. The body also needs a reason to keep muscle. Walking is useful, but resistance work gives a stronger signal. Even light bands or bodyweight exercises can help preserve function during weight loss. Weakness often improves when food and muscle use are both addressed. If your symptoms sound like true low blood sugar, do not guess. Check a glucose reading if you can, especially if insulin or sulfonylureas are on board. In that setting, quick sugar may be the right short-term move. Repeated true lows usually mean the treatment no longer fits your intake. Dose increases matter too, especially when weakness worsens after each step up. If weakness reliably gets worse with each dose increase, your body may not be tolerating the current step well enough. Continuing to escalate while food and fluids are already reduced can deepen the mismatch. Sometimes the better move is not to push through, but to hold the dose and review the pattern first. Prevention starts with a floor. Set a protein target, a fluid target, and fallback foods you can tolerate on a rough day. Planning for bad days matters more than planning for perfect days. The body usually gets into trouble gradually, not all at once, which is why early function changes are worth noticing. Track function, not just body weight. Ask whether stairs feel harder, whether errands leave you wiped out, or whether standing up feels worse than it did 2 weeks ago. Those clues often appear early. The scale can look better while the rest of the body is showing signs of strain. In most cases, weakness on Ozempic or Mounjaro means your food, fluids, muscle support, or dose pace no longer match the treatment. Fix the food, fluid, muscle, or dose pattern first. That is how you stop guessing. That is how you decide whether the next step is food, fluids, dose review, or medical care. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.